So SSRIs and SNRIs are antidepressants, and I couldn't really come up with an easy way to memorize the names, but at least they're pretty popular, so you've probably seen them before. So start with serotonin reuptake inhibitors. So it's Prozac, which we've probably all seen, Paxil, Zoloft, Luvox, Celexa, Lexapro. One more time, okay? Prozac, Paxil, Zoloft, Luvox, Celexa, Lexapro. So they're pretty fun to say anyways. So I kind of categorize them by so Celexa and Lexapro both end with pram. So if you see that it's a antidepressant and it's in the question, and you see pram, then you could probably assume that it's an antidepressant, and if you see the C in front of it, then you know it's probably Celexa. Okay, and if you don't, then if you see the E, then you might assume that it's Lexapro. Okay, Prozac's easy because I think most people know fluoxetine is the generic name for Prozac, and once you see that, you can kind of figure out Paxil basically is almost pretty much similar spelling. It's fluvoxamine. So if you see fluoxetine or fluvoxamine, you can assume that's an antidepressant, and you already know that Prozac's fluoxetine, so fluoxetine is probably Paxil. Okay, and then Zoloft and Luvox. I think most people have seen Zoloft. Okay, so these are your SSRIs, and then your SNRIs. Ms. Brett only put 2 on the sheet of her handout, and they're pretty popular. You know that Cymbalta and Effexor. Cymbalta, most people have seen that commercial, right? If you're depressed, Cymbalta can help. I think that's what it goes, something like that, whatever it is. So these aren't too hard to remember either. So Cymbalta, Effexor, you know they're SNRIs, and Cymbalta is duloxetine, and Effexor is I don't know how should I say that, venlafaxine. So these ones you pretty much just have to memorize them. I couldn't figure out a really easy way. But the side effects that you have to be concerned about, I didn't list all of them. There's like 14 of them. I don't think they're all important, but you should take a look for yourself. But I just kind of put, it helped me to remember SSRIs and SNRIs basically have the same side effects. And the ones that you might hear complaints about are S for sexual dysfunction. Sometimes men have trouble getting up, or women have trouble having an orgasm. And if it's really bothersome to them, they can talk to their doctor, and they can have a different type of medication that won't cause that, such as like bupropion or Wellbutrin doesn't cause the sexual dysfunction. Okay, S for increased risk of seizures, especially these people who already have like a history of like seizures, epilepsies, those type of things. They're going to be you're contraindicated, right? So you have increased risk for seizures. You have S for sweating. It does increase their sweating. I put S for sick because the symptoms of nausea, vomiting, diarrhea, headache, dizziness, dry mouth is kind of like what I feel like when I'm sick. So I just kind of put S for sick. Put all these together in one lump. And then S for sunblock because it does cause photosensitivity. So make sure to tell your patient to wear sunblock when they go out into the sun. S for sleep because some of these cause insomnia, and then some of these cause hypersomnia. So S for sleep, depending on which one it is. So if it causes insomnia, then you might want to tell a patient to take it earlier in the day, or have the doctor recommend the patient takes it earlier in the day so at nighttime they can sleep. They might not want to take it with caffeine. And then if it causes hypersomnia, they might be very sleepy, so they might not want to drive. They want to take it closer to bedtime. Okay, those are the type of questions I've seen. And then S for serotonin syndrome, because you know these are serotonin reuptake inhibitors. So you don't want to take it with other drugs that kind of do the same thing, like MAOIs or like St. John's wort. Those are 2 that I've seen in NCLEX questions. So you want to take them together because you would have a risk of getting serotonin syndrome. Okay, and then S for small because it does sometimes cause weight loss. So there you are. This is for the SSRIs and SNRIs.